A $4 million federal block grant will allow Texas to double the number of sites offering early psychosis treatment, specifically into rural communities.
This program helps young adults who've been diagnosed with a psychotic disorder in the last 2 years. But as KXAN's Steffi Lee shows us, this only helps a fraction of the need in Texas.
Funding some of that medication, funding their education, all of those things we can help with.
This federal funding will help Andrews Center Behavioral Health Care reach more Texans impacted by early psychosis.
A lot of people that I talk to, they're saying they wish they had something like this closer to them. Access to counseling, access to job support, access to seeing a therapist weekly. A lot of people just don't have those resources in their areas.
Texas really needs to be able to serve 6,000 people at any given time.
Psychosis can include paranoia, delusions, or disordered thoughts and speech. It doesn't discriminate, and about 100,000 adolescents and young adults experience early psychosis each year. Now, last fiscal year, the state served just over 500 people each month, with the 10 current sites offering coordinated specialty care. With 13 additional sites, health officials expect to serve 200 more people each month.
It's not everything that we need, but it's a huge step in the right direction.
Greg Hansch says for the Texans left behind,
some of the bad outcomes we see when people are unserved or underserved are homelessness. We see school failure. We see criminalization of mental illness, people ending up in jail or prison.
Mental health experts hope programs in urban areas can get more future support too.
If there's a program in an area where there's a higher demand for services than there's the capacity, then we need to increase the capacity.
Steffi Lee, KXAN News.
The programs will get established this summer in Austin. Integral Care is one of the locations offering coordinated specialty care services through a program called RAISE. Teams help with college enrollment, suicide prevention, medications, and independent living skills.
We know that recovery is possible. Many people that have had one episode of psychosis may not experience another episode, or those that do go on to experience further one know how to manage them and lead fulfilling lives.
To learn more about RAISE, you can head over to our website, KXAN.com.